Hello, everyone. Welcome back to the webinar series, part 3 of the coronavirus. I'm Ariela Wagner, the founder of SunRay Construction Solutions. Today, we have a fabulous webinar. This webinar is dedicated to Dr. Ronald Wagner, who is my father and happens to be the father of also Daniela Hermelin, Dr. Hermelin, who's my sister. He was a brilliant infectious disease doctor. So may his name be a blessed memory. And today we have Dr. Hermelin, who is an assistant professor of pathology at St. Louis University School of Medicine and teaches subjects that cover vascular and blood systems. On top of her incredible career, Dr. Hermelin is also a mother of 6. So today's topic we are going to discuss are the COVID pandemic in the United States, how the disease is spreading, a summary of safeguards that can be taken, when we can expect to see it subside possibly, and a question and answer session. So without further ado, I would like to introduce my incredible sister, Dr. Daniela Hermelin.
Thank you, Ariela. Thank you for the very warm introduction. It's wonderful to be here with you today, and for everybody that has attended this webinar. It says a lot about how much you are caring and really want to be knowledgeable of what's happening out there and how to protect yourself and how to protect others. So today, I hope that I could just provide you with a clinical update about the COVID-19 pandemic that exists today in the United States. Just talk to you a little bit about the background, and then I'll go into some specific topics such as how the virus is actually spread. I think people really want to understand the case fatality and the types of people that are having very severe disease. Then I would like to talk to you about some of the epidemiological insights, such as how can you get tested, if a person can get reinfected, how long does immunity last, and about wearing a mask and social distancing. And then I'll finish off with a little bit about when is this all going to be over? Do we have an idea? And what is on the horizon in terms of medications and therapy that exists today? So my background, again, is I'm a pathologist, so I work closely in the laboratory, and I also cover the blood bank and any procedures that involve blood products. So I've been on the front lines dealing with testing, and I still oversee patients that require transfusions and any procedures. So being at the hospital has been quite an experience, and I'm very grateful, especially to my colleagues up in the ICU. They really are on the true front lines, but truly any nurses or doctor who's on the floor, and I have to say, even the laboratory staff, we are all, I think, at risk. So I appreciate so much everybody's support and everybody's support at this time. It's pretty outstanding. So let's just kind of get back into this topic of the background. So we know that this virus, it did originate from China in the Wuhan region. We know that the first cases came out of the Wuhan market. It was probably something that really was established of November, December of 2019. The first case arrived in the United States on January 20th, 2020 in the state of Washington. But since that time, so since January 20th, we have about 250,000 cases identified across the United States in just less than 2 months. And we have been really restricted in our testing capacity. So right now, our major test is using what's called, it's a molecular test where we identify the RNA of the virus, the molecular genome of the virus in the blood. So we don't actually measure viral particles. We're measuring the DNA that is in the bloodstream. And that is what we define as being positive. And unfortunately, over the last few months, we've had very limited capacity in our testing reagents to actually test the virus, and also simply the testing swabs, the ones that we stick up the nose or down the throat, we're even limited to those. So we ran into some problems with that, where we're turning down people who want to be tested. So we've been really restricted on who we're testing. So it's going to be individuals that are in severe or have severe symptoms or are in high-risk groups. That makes this a problem because not everybody can get tested. And that makes that a problem on an epidemiologic level, because we define the rate of fatality based on the number of infectious people divided by the number of deaths. So you may see in the news that some countries have a higher rate of fatality. So for instance, you may see in the newspaper that Italy had a rate of fatality of almost 11%, and Germany having less than 1%. Globally, it looks like around 4.7%. But truly, the more people the more we can really fully understand that rate of fatality. So a few weeks ago, what we did know is about 80% of the people who contract the virus generally have mild symptoms. So I don't really like calling it mild, but we say mild because it's just flu-like or cold-like. So you can have cough, fever, cough, fever, and you can have sore throat. You can have myalgias, which is muscle pain. Very interesting. A lot of people lose their sense of smell, which comes back, but it is very common in this virus. And people just feel like a lot of muscle aches. So they have a dry cough, they have fever, they have shortness of breath. Excuse me, I didn't mention that. So mostly lower respiratory symptoms, but it can come with a sore throat and sort of cold-like symptoms, runny nose. Amazingly, young people are spared, children are spared generally. We haven't really had any fatalities of children, but it seems to be that the people that really are affected are people that are age greater 60 and above and have other diseases. So they have diabetes, they have heart disease, they have other respiratory disease, or other cancers and malignancies. So again, 80% of the people are going to have what we call mild symptoms, which in that case, you would go into self-isolation and just do what you would do if you had the flu, get into bed, hydrate, take care of yourself. There has been some things in the news that talk about non-steroidal inflammatory medications, so that you should stay away from that. At this point, I don't think that there is enough guidance to really say that that is true. So I wouldn't clearly say that taking a non-steroidal anti-inflammatory is dangerous. They haven't really proven that yet to be the case. Then there's another set of patients. There's going to be about 10% patients that are going to be in the critical. So they're going to be into the hospital. They'll be on the floors. They're going to need a little bit more hospitalized support. Then there's going to be another population, about 10% of the population, that's going to be severe. They're going to be in the ICU. They're going to need, they're going to be under a ventilator. They're going to be intubated. And those are people that will either make it or will not make it. That's what we're seeing. What's crazy is that we're finding that 20% of the people that end up in the ICU are actually people with no risk factors. They're young, they're healthy, they have no other what we call comorbidities or diseases, but they are ending up in the ICU. And that is including, unfortunately, many of our healthcare workers that were exposed to patients, and they were exposed to patients either in the ICU or on the floors and weren't protected. So again, you have, about 10% that are going to need hospitalization, another 10% that are going to go and be in the critical ICU sections in severe disease. And then We think that this causes about 2% fatality. So there's going to be that group of people as well. And we're still trying to understand exactly why some people are at a higher risk. It seems that the disease itself, it causes respiratory issues. But then when you have advanced disease, what ends up happening is people develop what's called a cytokine release storm, which means that their body is trying to deal with the infection, and the immune system is responding in a very drastic measure. And one of the ways that our body deals with inflammation is through the release of these mediators called cytokines, and the cytokine release storm is causing shock. And it seems that people that do not have very good hearts or very good respiratory status usually can't make this portion of the disease course. We're also seeing that many people develop clotting disorders, and we're still trying to understand that this is more recent data that's coming out from investigating autopsies of patients that have passed away from the coronavirus, from COVID-19. So what's interesting is that there is so much that is unknown. It continues to evolve and develop. We have, physicians that just say we are just not sure. We do not know at this point. This is new, and the data evolves daily. And what's interesting is to be in a position, it's very humbling to just continue to say we don't know. At this point, if you suspect that you have, you may have the disease or you may have contracted the virus, it may be difficult to get tested. What I would recommend is that you would call your local county health department. So for me, it would be the St. Louis or the Missouri County Health Board, and they would be able to direct you to a testing facility. They'll usually screen you, or they'll direct you to another site to be screened and see if you would be if you would meet the requirements to be tested. Again, most of the testing that's being done right now is the molecular PCR test that we're looking to see if there is viral RNA. And but there are more rapid tests coming out. Those are in select locations that are actually looking to see if a person developed an antibody response. These are more rapid tests. At our hospital, we do offer the molecular test, so that's the RNA test. We run that test twice a day, 7 days a week. And so we usually get that test back between 6 to 12 hours. The more rapid test that's looking at the antibody is going to be even really quick, under an hour, under 2 hours. So again, this is just getting this test distributed, that we have to look at this test and make sure that it's validated. All of this takes time. I'm not sure yet who's going to be having this test. We're considering it even for our own hospital, but it hasn't been done yet. So at this point, most places just have the molecular PCR testing. So let's talk about what about if you get infected? Can you get reinfected? So it seems at this point, if you are infected one time, usually it looks like you are immune for life. But again, that is coming out, that data. We still don't have enough to know experience behind our belt. Interestingly, we have no evidence that this virus is transmitted through blood. So please go out and donate. We are at a tremendous blood shortage right now. So if there's something you want to do, if there's a way you want to help, I would say please donate blood. The blood donation centers are an extremely, extremely safe place to be right now. People who donate blood are healthy. You go through a major screening process, and if you are feeling well, this is an amazing thing to do. We have historical data that shows there has never been any cases of coronavirus that has been transmitted through blood. We know that from SARS, we knew it from MERS. Those are also different types of coronavirus. diseases from the past. So please donate right now. Another interesting thing going on in the blood donation area is that we are starting to collect plasma, which is the liquid portion of blood that has antibodies to help treat patients with the coronavirus. So we're taking patients who, thank God, have now recovered from the coronavirus, and they have lots of antibody to fight the virus, and we're collecting that plasma now of recovered donors, and we're going to be using it to help and infuse and administer into patients that are in the severe and critically ill condition on the hospital floor. So that is an interesting area. I am personally involved in that, and pretty neat to see all of this come full circle now. So let's talk about the social distancing component. We know that the virus, which is known as SARS-CoV-2, that's the virology name for the virus. You've seen two names being passed around. We have COVID-19, that stands for coronavirus infectious disease. So that's the name of the disease, COVID-19. And then the actual name of the virus is called SARS-CoV-2. So the virus SARS-CoV-2 is transmitted through respiratory droplets. The particles are usually between 5 to 10 micrometer in size. So an N95 mask truly is the only way that you can protect yourself from respiratory droplets. So an article just came out recently, I think yesterday, that showed that surgical masks, cloth masks, do not protect the respiratory droplets if someone coughs. I'm not saying if you are walking and there's asymptomatic people, where people aren't coughing or not sneezing. So if a person is not infectious, or recovered from the virus, a cloth mask or a surgical mask would be sufficient. But people who are in the hospital, or a person exposed to someone who is symptomatic, it is infectious, which means that they are coughing, sneezing, or have the virus, and they're talking, because it can be transferred not only from coughing or sneezing, but if respiratory droplets come out of the mouth while a person is talking, they can become infectious. The best way to prevent that would be through an N95 mask. Like I said, the data that I just saw is that a surgical mask and a cloth mask doesn't necessarily protect you for that those respiratory droplets. You need to practice safe distancing. So distancing means to be 6 feet away from someone. We know that a person can contract the virus within 6 feet. So try to maintain 6 feet space wherever you go from another person. And so simple, it's coming back every day, but just following basic hand washing hygiene. So washing your hands, don't touch your hands to your face or your mouth, and washing your hands often. It's really amazing, something that simple can help prevent the spread of the disease. As I mentioned before, that the disease is spread through respiratory droplets. So when particles will emit in the air while coughing, sneezing, or talking, the droplets can land in what's called the respiratory mucosa. So even like the mouth or the inside of the eye. So that's why people also protect their eyes by wearing, a mask. A protective gear for their eyes. Especially you'll see pictures of nurses and doctors in the hospital covering their faces with face shields. So that's an important way to protect yourself from getting the virus. The virus can survive on innate surfaces. It has been shown that it can actually stay on surfaces for up to 9 days, which is a little frightening. So what I personally use is a disinfectant that I made in my own home. It's simply 1 gallon of water to 4 tablespoons of bleach. So, you could put that into a spritzer, an old Windex. And so I spray down my surfaces, my countertops. Every time I go food shopping, I leave everything in the garage, and I use my spritzer. I just wash down everything before it's brought into the house. I put all my fruits and vegetables into the sink immediately, and then I wash them by hand. If they have an outer peel, I do use just soap and water for those items. But the other things that may have been touched, like outside wrapping, I will just spritz it with my bleach solution. So, it's good to clean with soap and water, but, also go after surfaces using a spritzer bottle. When you go to the supermarkets, definitely mask up. I'm not saying that you have to wear an N95 mask. Hopefully people going to the supermarket are not symptomatic. So you should protect yourself with a mask. You can think about wearing, sunglasses inside the store, some sort of protective eyewear if you'd like to. And then when you go to the store, you could also wear disposable gloves. When you finish food shopping, I would recommend to take off all of your clothing and change them before you get into the house. And then, of course, wipe your hands thoroughly. I personally, since I'm going into the hospitals, I take off my clothes and I go directly into the shower. That's one extra step. Washing your hands might be sufficient, but if you have time to take a shower, even better. And then I wash my clothes in the hottest temperature setting, and then I dry them at the highest heat setting, and that's good enough. So if you think you're going to go out more than once in that day, you can just bulk your clothing and do it all at the same time. So let's just talk about when is all this going to end? I'm sorry to tell you again, it's one of those things we just don't know. The social distancing measures can really help in reducing the number of infections. We saw in Wuhan, there was this incredible steep number of infections that happened in a short period of time. What we may be seeing in the United States, not necessarily in New York or California, but what we are seeing is that there will be a prolongation of the curve. So we're flattening it, meaning the number of cases that we see may be flattened, but we may be actually prolonging it through social distancing. That is beneficial in some ways because we are not overwhelm our healthcare industry. We'll be able to take care of as many patients as possible, but I know that social distancing can have a tremendous toll on the physical, mental health outcomes as well as the economy. So I'm not really sure, how long we can maintain these social distancing. The question is, how long are we going to actually have this virus in our midst? So as you know, we were told that we're going to maintain social distancing until April 30th. I think that the virus will continue to persist into May. At least that's true for the St. Louis area. We do not know if there's going to be a resurgence. We usually are able to tell what the cycle of a virus is going to be by looking at the southern hemispheres. So looking at South America, that's usually how we will develop our vaccines. So we look at what strain of the influenza is affecting the southern hemispheres and based our predictions on that. The southern hemispheres right now have coronavirus. So I think that really is more of a situation where it's infecting the world, on a global level. So we don't really know if it's going to behave like flu, where it goes away in the summer and maybe will resurge in the fall. There is this idea that it will come back, and so there will be another sort of exposure period. So that brings us to medications. There's multiple trials going on right now. You've heard on the news hydrochloroquine using with azithromycin. We have another drug that may be promising called ivermectin, which is an anti-parasitic drug There's also some other antiviral drugs that are in trials right now at different hospitals. I'm frustrated to say this, but again, we don't have enough data to say what's been working, what's not working. And also we're going to be adding the convalescent plasma, the plasma taken from donors, recovered donors. So we'll see how that works as well. We don't have enough data to really say if that even works. To tell you the truth, our biggest bet is the vaccine. So right now the vaccine is in stage 1, phase 1 human trials. You may have seen in the news the first person who received the vaccine. But we're very careful, the FDA is very careful about, you know, really getting vaccines on the public, into the public, and really the timeline for availability for this initial vaccine is early to mid 2021. So we're truly, I'd say at least the minimum 9 months away from a vaccine. I was told more like a year. So it's really the vaccine that's, to me, is the golden ticket to this. But we're not going to really see that for some time. So at this point, I would say that, you know, everybody is susceptible to this virus. The best thing we can do is to stay isolated. If you can imagine, what we would love is to freeze everybody and put them in place and allow the virus to run its course. But of course, we're humans and we're social beings and we can't do that, and we need to go to the supermarkets and etc. So what we're doing is we're trying to maintain that social distancing. As many people as you interact with is going to be, you know, the higher the chances of you being exposed to the virus and contracting the virus. You know, as much as you can to stay protected with a mask, with gloves, washing your hands, not touching your hands to your face. And God forbid someone in your home does get the virus, put a mask on that person. Try to reduce the you know, other people in the household from getting infected. So in terms of working, if you have essential work, I think that construction workers are in a good space where they are able to work, where they can be separate from people, but definitely maintain that 6-foot distance, and you know, as much as possible, and you know, just stay safe. I can't say any more than that. I think that people who don't need to work should stay home, but you know, definitely there are going to be people that are going to be essential and need to work, but just maintain those social distancing guidelines when you work, and wear a mask if you can, and wash your hands as much as possible. So I'm going to leave maybe 5-10 minutes for questions and answers. I do have to get back to my own work at myself. So Ariela, if you want to open it to maybe a 5-10 minute of questions, maybe I can.
Absolutely. So if anyone has any questions, here's a great opportunity for you right now to ask a doctor on the front lines. You can ask your questions in the box on the right hand side. So so far, let's see, hold on one moment. Looks like we do have several questions. We recommend a basic sort of mask for everyone, even a bandana in worst case.
Yeah, you know what? I will email Ariela 2 websites. They're YouTube videos that show you how to make a homemade mask simply using a t-shirt. So I'll send that. You just need a t-shirt and a pair of scissors. And so I would recommend maybe making one using a cloth mask. You want to use something that is, you know, is breathable. And there's definitely so many different options just to make your own cloth mask. If you have any friends that can sew, I can also send a video in making a sewed mask as well. So I'll send those over to Ariela.
Okay, great. Another question, what impact will long-term social distancing have on construction sites? Will there be a need for further stoppages of ongoing construction sites?
I think that's a great question. Yeah, it goes down to the that I was speaking about how social distancing does cause psychological, physical, and economic problems. You know, I think that we will reach a surge. You know, we're in New York this week. It has reached the climax of the number of individuals so it has peaked. So I think that there's going to be cities and states that have been basically exposed to the virus, and it could be that we can resume. I'm not going to say normal, but maybe go back to having somewhat back to, you know, let's quote normal work environment. But they will probably have more rigid guidelines, and there's going to be a lot more screening and notification of people, your colleagues and people in the workforce. It could be that your employers, you know, set up screening before getting to work. So just more rigid guidelines. I can see that in the future. I definitely think people need to be getting back to work at some point. It's a necessity for the world at large. So I think let's stay tuned and see what happens in the next few weeks. And you know, like I said, I'm in St. Louis. So for us, we're starting to be on that rapid rise of the curve now. And we just have to hang on tight and see what happens, I would say, over the next 3 to 4 weeks.
There was one more question, and then I think this will be the last question we'll take, because we know we don't want to take too much of your time, and we appreciate you giving this very brief lecture on the coronavirus. The question is, Ariela, do you have any suggestions for developers who have cleared land and have been given work stoppage orders from their local or state government? Right now, what I need to do is I need to speak with the attorneys to discuss that. If you have a stop work order from your local or state government, I think that what we can certainly do from just this simple side of it is, again, if it's essential work versus non-essential work, and then maybe speak with local government to discuss how this social distancing will not, this specific part of construction, clearing land, how will that impact the spread of the coronavirus? I will also speak with an attorney to discuss that question itself, and then I could send it out to everyone who's on the webinar this morning. I can understand the concerns and fears for the construction, every industry, of jobs shutting down, not having the ability to work. What is the future? These unknown variables is very frightening for everyone. But I think, again, essential versus non-essential, how can you go to work in the construction industry and be safe at the same time? So Dr. Hermelin, thank you very, very much for this extraordinary lecture you gave us. We'd like to wish everybody a happy Passover. Tonight is the first night of Passover, and of course over the weekend is Easter. So we'd like to wish everyone a happy Passover and Easter. And again, Dr. Hermelin, thank you very, very, very much for taking time out of your incredibly busy schedule and speaking with us today.
Oh, thank you so much, Ariela. Thank you so much to all of you for attending today. I wish you and your continued safety and peace of mind during this very challenging time. Thank you for all your contributions. And last plug-in, please go and donate blood.
Thank you.
Thank you.